everyone, welcome to researchmd.com. Another great presentation. We're going to go deep into cardiology board review today, okay? We're going to teach you some concept which you usually ask for the board, especially cardiac murmurs, several questions can come in, okay? So today, again, my name is Dr. PRAMIL. So let's go into what's the clinical scenario. 16-year-old patient come in. Listen to the heart. There's a heart murmur. Lower left sternal border, there is a hollow systolic murmur. Okay, that's the only thing information we have. So, what are the most common answers people usually pick? That's the whole purpose of this presentation. They could pick atrial septal defect, they can pick patent ductus arteriosus, and tricuspid regurgitation. So, we're going to look at each one. Why can it be? So, when you talk about atrial septal defect, okay, so I'm going to go over here, right here. It's like a 16-year-old, right? It's like a congenital heart defect. What is the, in a usual presentation of ASD, they usually present kind of later on, like 40 to 50. So if I'm writing a question for ASD, first thing I'll write, I would not write a 16-year-old there, okay? So, and when we talk about the murmur itself, what is a murmur in ASD? It's a systolic murmur. It's not a hollow systolic murmur, okay? And what is the most common word they use? It's the fixed splitting, okay? That's the word you just have to remember. If you see systolic murmur, you say fixed splitting, and the age is not 16, age may be like 40, that could. But in this patient, that's not the case. So, boom, not. Don't answer that. The patent ductus arteriosus, again, it's a congenital heart defect, right? So what happened to patent ductus arteriosus? You got this machinery type murmur, okay? It's a continuous murmur. When you talk about continuous murmur, that's in systolic and diastolic. It's not a systolic murmur, so you can take that also. And the characteristic, they're going to put in the question is, patient is usually cyanotic, okay? So oxygen saturation problem and all that. So if I'm writing a question about patent ductus arteriosus, I'm going to put machinery type murmur, systolic and diastolic period, and then patient is usually cyanotic, and the patient is going to be younger age group, okay? Just like 16, that usually fit that picture. When I talk about tricuspid regurgitation, first of all, I'm not going to put like a 16-year-old with a tricuspid regurgitation, maybe like an older patient, okay? So the murmur in tricuspid regurgitation, it's a hollow systolic murmur. And the characteristic finding, or somebody is going to, if I'm writing a question, I say it's affect with inspiration, okay? So you got a hollow systolic murmur, it's usually left-sided, but affected by inspiration, okay? That's the key word, remember. So none of this are the answers in this. So what is the correct answer in this patient? The correct answer is, first of all, 16-year-old. Then I'm thinking, right? What is it? Is it a congenital defect? Most likely. The examiner is kind of telling you, hey, there is congenital defect. Then I think, what's the most common congenital defect in the world, heart, when we talk? Is ventricular septal defect, okay? And then I look at the age also. VSD, what age? Usually kind of like, younger age presentation. So that fit that criteria, right? 16-year-old. And then I think most likely, most of the examination question is like what's the most common type. Then I'm going to take like the zebras out there and trying to confuse you. Everything in the world, you need to know what's the most common cause, okay? So I know, most common congenital heart defect is ventricular septal defect. I know it fit into that 16-year bracket. I know it's in the lower left sternal border. I know there's a hollow systolic murmur, right? So my answer in this patient, we got VSD. Okay, so hollow systolic murmur, lower left sternal border. Thanks so much for watching. We'll be back with another presentation soon. God bless.